Introducing the all-new Corolla.
It is a growing problem.
While news that a homeless woman was camping outside of Guam Memorial Hospital after being discharged this week caught the attention of PNC, GMH Administrator Joseph Verga says the situation is not uncommon.
We do have a number of patients here at GMH and at the skilled nursing unit in Barrigada that are placement issues, meaning they don't really need to be in the hospital or a nursing facility, but they just have nowhere to go.
Because these patients have nowhere else to go, they often remain at the hospital, even though their condition doesn't necessarily require hospitalization.
This situation also results in our costs increasing, going up. But again, we become the agency of last resort for many of these folks. And it is a growing problem. Of course, the beds are also occupied by folks that can be discharged, but we can't. And so that's why sometimes that folks need to come here might have to wait a little bit for a bed, because there are a cluster of these individuals that we just can't, there's no place to put them and we can't do anything with.
Many of these individuals do have medical needs such as daily infusions or dialysis, needs which Verga says could be met elsewhere if the right resources were available. These
are individuals who don't have any, let's say, acute needs, meaning they don't need to be in a hospital bed. These needs could be met if there were some type of supervised residential facility. And I think that's really one of the things that's really badly needed here on Guam is a supervised residential facility that could provide basic medical needs for these individuals that don't really need to be hospitalized in a much less costly setting.
The Guam Homeless Coalition last year recorded 364 households living without homes during the annual point-in-time count, with a total of 1,272 homeless individuals on Guam. Another count will be conducted next Friday. Homeless Coalition member Frank Tyron says canned food, hygiene products, and other necessities will be given to the individuals they meet during the count. But they'll also try to connect them to the resources that are available to them. And nurses from the Department of Public Health will be on hand to assist as needed.
After we have surveyed them, and if the families or the individuals would like us to connect them with the public health services, we do have referral forms that we could get that rolling. We can have them fill it out, and we'll get their demographics, their information, and we can refer them to the nurses.
Data from the point-in-time count is also used by the Homeless Coalition on grant applications to seek funding for homeless assistance programs that hopefully could reduce the burden on the island's only public hospital.
Betsy, we've worked so hard, using GMH resources responsibly to improve the culture and safety culture and financial standing here at the hospital. But there are issues beyond our control, such as this, that really complicate matters. But it's something that I think it's all in our best interest to really work on and address as a community.